It's time for us to talk health. And today on our health segment, as you can well imagine, COVID-19 is still taking front stage. I have with us Nana Kofi Kwache. He's joined us earlier before on a different segment. But he's going to help us to understand what it is, the myth versus the facts of COVID-19. He's an expert in this field because he's in public health and all of that. Let's talk to him. Nana Kofi, good morning.
Good morning.
How are you?
Fine, thank you.
Okay, so this whole business, there's a lot of things that are going around. People are purporting to be, well, they don't show their faces, but they put out information and claim certain things to be facts, and I even saw one that was a little, I thought it was very diabolical, because it came under the name UNICEF, but my instinct was like, this is not UNICEF. I don't see certain things in place for it to be UNICEF. With a little bit of searching, I discovered that truly it wasn't UNICEF. Somebody just sat somewhere and came up with a diabolical scam to deceive people. I don't actually even know what they gain out of doing those kind of things. But myth versus facts.
Okay.
Let's try and understand what is the truth versus the lies that are being put out there. And we'll show some of the things that people are saying as well, so that we can debunk those ones. But just give us the basis. What's the truth of COVID-19?
Well, COVID-19 is caused by a coronavirus. These are a type of virus that are not new to us. 20% of all common colds in the world are caused by coronaviruses.
Okay.
In this particular instance, there has been some kind of change in the RNA, the basic coding of the virus that makes it particularly transmissible between people, and particularly infectious, and causes serious disease when they get it.
Okay.
Those are the bare fact. It's not a chemical weapon, it's not any of those things. What it is basically, in public health, we call it a zoonosis, where it's a virus that exists in animals. Because of more frequent contact, invasion of animal habitats, we're more in contact with the animals, and we can get them. The problem is when those things have the ability to pass from person to person after the animal to human transmission. So SARS, MERS, all those other ones were examples of the same thing. This one is just particularly transmissible, and it targets the lungs, which is what makes it a critical illness for about 20% of people. But it is a naturally occurring thing that just has caught us a little bit off guard this time around.
Okay. All right. So now that you mentioned the issue of getting caught off guard, why did we get caught off guard? Because in 2003, we had SARS. In 2013, we had MERS. 2012, 2013, we had MERS. Why did we get caught off guard?
The thing with these kind of phenomena is you can plan for them, make sure that you are ready for the scenario where it happens. But you can't predict which kind of virus is going to become a big, pandemic. Those things are much harder to do. You have to model them. Variables are many. It's hard to do. But as far as preparedness goes, that is something where I think, from a policy perspective, around the world, there have been some pretty serious failures. And especially in this respect, because there are people, it's not like Ebola where when you get it, you are sick, everybody can see it. In this case, there are people who get it, have no symptoms. So the urgency to take avoidance measures, preventive measures is just not as high among the general public as well. That's complicated. So there's a policy failure, but there's a lack of proper risk perception and risk awareness as well, not just in Ghana, pretty much all around the world. You have places like New Orleans. A couple of days ago, they were given an official lockdown of schools and schools, other big institutions. People went out to Bourbon Street to party because, especially for young people, the risk isn't that high, and the perception about the consequence of their actions also isn't that high. And you add that to a lack of policy preparedness, and then you have this kind of perfect storm we're brewing here.
Wow. Okay, so for viewers who are joining us and watching on Facebook, you can use the hashtag Breakfast Daily and the WhatsApp line to send us messages if you have any questions or comments to make. Is 0550-585832. If you happen to be outside Ghana and you want to speak to Nana Kofi Kwache, use the country code +233. All right. So, what is it that makes people want to disseminate lies? I mean, what do you think it is? Because it beats my mind. Why would somebody look? I've got one here. Let me just read it out to you. What they actually say. I've got one here. It says, coronavirus COVID-19, and by the way, it's under the
UNICEF
the logo UNICEF, right? But it's not from UNICEF. Coronavirus is large in size, where the cell diameter is 400 to 500 microns. I guess it's the microns that we're trying to say. And for this reason, any mask will prevent its entry. Okay. Yeah. Now, it's saying basically that it's so large that you can use whatever. That's it there on the screen. Okay. It's so large that you can use whatever mask at all, and it will prevent entry anyway. So you're good. It doesn't matter. You don't need to be very specific about the mask you use.
That is
math or myth, fact or myth.
That's a myth. That's not true. The two types you're seeing in town and generally around the world, the predominant type really is the surgical mask that you see people wearing. The surgical mask is good for preventing a sick person when they cough or when they sneeze from putting the droplets out there, getting on surfaces. But it's not field-proof. So there is an amount of the virus particles that are going to get through anyway. For healthy people wearing those surgical masks, that's not field-proof either. The microns, the size of the viral particles actually are small enough to get through. You're not sealed off your whole face either. There's space around your mouth, around your nose where particles can get across. We're talking about tiny microscopic.
Yeah, I hear they're like in nanometers. It's like 100 nanometers or something wide.
There's no basis to expect that a surgical mask, for example, or in particular, would give you full, fail-proof protection.
Yeah.
There is what we call an N95 respirator mask. That's what a lot of medical professionals use in highly infectious environments. But even before you actually use those, if you volunteer in an emergency room, if you're in medical school, one of the things you do at the beginning is to do what they call a respirator fit test. And they do that because we all have different face shapes and physiognomies. And the point is to make sure that the N95 respirator fits around your nose and mouth.
Right.
So if you pick it off the shelf and it's not your right size, not your right fit, it's not going to be useful for you. And on the question of the masks in general, we shouldn't really be going out there and hoarding them or buying them. The people who are going to need them the most are the frontline healthcare workers. We've seen prices in Accra go up from 50 pesos to 3 cedis, 5 cedis. In a country where we know a lot of healthcare workers have to buy their own supplies because of the state of healthcare financing in the country. We need to be thoughtful here, think about the big picture, allow those things to be maintained or procured by the healthcare sector so that those frontline healthcare workers can actually protect themselves.
Okay, fantastic. I think that's a very good call. There's one here that says, gargle with warm water and salt. It kills the tonsil germs and prevents them from leaking into the lungs. So this is presupposing that the coronavirus is basically going to be sitting around the tonsil area and then leak into the lungs. Now, what's wrong with all of this?
Well, again, obviously, this is not a real thing.
No, it's not. It's definitely not from UNICEF.
Gargling salt
even the construction of grammar is bogus.
Gargling salt water is not going to prevent you from getting a coronavirus infection if you're exposed to someone. Again, the viral particles are very tiny, so if you breathe in, when somebody sneezes around, you touch a surface, you touch a mouth, nose. Yes, there'll be some of the viral particles in your nose, but a lot of them also get into your lungs, which is the issue. If your body can't fight the infection quick enough, then you go on to develop viral pneumonia. But salt water in Peninsula, I mean, it's not really going to do much for you in terms of preventing a viral infection.
Yeah, yeah. Okay. So there's this myth. Oh, well, let me not say it's a myth. There's also this thing going around that suggests that let's get some alcohol, some Black Label, Castle Bridge, different, Smother of Ice. I've heard of different, tequila. I've heard of all different kinds of things. And people are saying it. And people actually, look, I've seen videos where I see somebody literally, he's washing his hands and someone is pouring, something like a Black Label on his hands as he's washing, and says that he's cleansing his hands of, don't worry about hand sanitizer. If you don't have any, this is good hand sanitizer. Help me out.
That's just a waste of good whiskey.
It's a waste of say that again. Say that again. I want to hear that again.
It's just a waste of good whiskey.
It's a waste of good whiskey. Okay, explain.
What you're trying to do in terms of sanitizing your hands is to kill the virus itself. You need to use a solution that has at least 70% alcohol by volume. Black Label, tequila, gin, most of these commercially produced spirits have usually 45-50% alcohol by volume. So it's not going to meet the purpose of actually killing the viral particle.
Okay.
If you're trying to make a homemade hand sanitizer or to figure out what you can use at home, you have to be using something like isopropyl alcohol, rubbing alcohol that has at least a 60% alcohol by volume. When you start mixing that with other things, obviously the alcohol percentage is going to go down.
Yeah.
So you want to start with as high of an alcohol percentage as you can. That's why we recommend rubbing alcohol specifically, so that as you mix things in it, you're not losing the essential ingredients. You can add other things. If you have the isopropyl alcohol, you can use aloe vera gel, you can use glycerine, anything but those things are really meant to keep your hands moisturized. Yeah. But the main thing is the 90%.
I also understand that
6% alcohol.
Okay, so I also understand that the glycerine and aloe vera are also supposed to slow down the evaporation of the alcohol as well.
Yes.
So that when you put the alcohol in, it stays a little longer on your hand.
Exactly.
Okay, fantastic. Good. Now, the question. Some people claim, and I know better, but some people claim that there's alcohol on the shelves for drinking that is 100%. I have this thing. Tell me whether I'm right or wrong. If it's 100% alcohol, it's too dangerous for you to drink. If it's less than, if it's 50% alcohol, it's not strong enough to kill any germs.
Yes.
How does that sound like?
That's correct. If there's 100% alcohol on the shelves here, then we have a problem. That should not. There's no alcohol that you should be drinking that is 100%. Every year we hear stories about some place in Kenya or somewhere in the world where somebody who makes the local booze has poured, methanol, ethanol in there. Yeah. People have gone blind, they become paralyzed. That is what causes that. So 100% alcohol, drinking
it can kill you.
It will probably kill you. So it's a particularly terrible idea. But of course, yes, if it doesn't have at least 60% alcohol by volume, then it's not going to meet the purpose of actually killing the virus. There's obviously some kinds of alcohol on the shelves that are sometimes 75% alcohol. Those are pretty strong. Some kinds of vodka, they are generally not very common. But if you have those, yes, those would work. But 50% alcohol, whiskey, gin, tequila, not going to do the trick. 100% alcohol, you might not have to worry about coronavirus. You have other problems coming.
Well, I like that. So let's talk about actually fixing the problem, or taking care of ourselves. Okay. The subject of social distancing. What does it actually mean in practical terms? Okay. And how effective is that? Okay.
So the idea behind social distancing really is to reduce contact as a means of reducing opportunities for transmitting the virus if you have it, or getting the virus if you're healthy. That's the whole idea behind it. At a very simple scale, telling people to stay 1 meter apart, 2 meters apart, that is a type of social distancing. Okay. But if they're so congregated, and if you have 2,000 people 1 meters apart in a place where they all have to use the same entrance and exit and touch the same handles, you're probably not going to meet the actual goal of preventing transmissions. So social distancing at its real essential form is by asking people to really interrupt the normal flow of life.
Yeah.
Don't go to school, stay at home. If your office can afford to have people work remotely, they should be doing that because we are trying to reduce opportunities for contact.
Yeah.
The reason we are doing that is because the reason why we think that's important is because 80% of people who get sick will probably have a mild to moderate infection. 20% of people will have a pretty serious problem where they will need some kind of medical attention. Those people include people who have the elderly in general, people who have things like cardiovascular disease, kidney disease, respiratory infections, or respiratory conditions like asthma. And you're trying to prevent those people from getting infected because you're thinking also about your health system capacity. The kind of care they need is not an injection and go home. They're going to need intensive care. So your ICU facilities, your triage facilities, all the things are going to making sure that when people are in a critical condition, they can survive.
Absolutely.
That's what helps keep the mortality rate down. So if your country doesn't do the basic things to prevent the risk of transmission, the risk of a rapid explosion of cases and a high peak of infections, the health system gets overwhelmed, and a considerable amount of people who are actually going to need that critical help will end up not getting it. And the consequences for them will be pretty dire.
Okay, fantastic. You have a presentation that you brought. Let's take a look at that and walk us through what it is that we're looking at here. So what are we looking at here?
So we're looking here about why social distancing matters. We're looking at 3 scenarios: people who are recovered, people who are healthy, and people who are sick. So the idea that so far that our working theory, working theory of the microbiologists is that once somebody gets a coronavirus infection and they recover, they are now immune. So we're talking about being able to pass on the virus. So as far as we're in contact with each other, sick people infect healthy people infect other people. But ultimately, over time, you end up with a scenario where everybody has had the infection, or a lot of people had the infection, and you can reduce the overall risks. Now, the idea behind social distancing is, there are different forms of doing it. If we have a free-for-all scenario, then what you see there with the orange dots are individuals who are sick. The gray dots are people who are healthy. And the more contacts you have by people just moving around freely, the more infections you get over time. So the graph above that, the chart that's moving above that, there's tracking cases of infection, the number of sick people overall. At some point, you're going to have a situation, if you don't do anything at all, no social measures, where the number of sick people is just going to be approaching the total population if you're not doing anything at all. So that's why we have to do some interventions.
Do something about it,
You can do a quarantine, which is the one on the upper right-hand corner. And with a quarantine, the idea behind it is to make sure that the people who are sick are all contained in one place. But we're balancing out not just the question of public health prevention, we're thinking about social disruption and people's human rights. You can't quarantine people away and say their families can't see them, deny them information, not say where they're going to be. And so quarantine measures tend to have loopholes, they tend to have gaps in them. So you can have infections getting out of the quarantine zone and infecting the general population. But generally speaking, your peak of infections, that orange chart above there, is lower than it is for
that's on the right
for
side.
free-for-all, Now, with social distancing measures, you can do moderate measures where, for example, in the chart on the bottom left, you have about 1/4 of all people staying put and the rest of everybody walking around. If all those people are walking around, if you have 3/4 of people walking around, the risk is that you're still having contacts and transmissions and all that. But you're still reducing the overall risk of the population. But if you go for intensive social distancing where you are closing schools, closing workplaces, asking churches to go on hiatus, mosques to nightclubs and all the social gathering places, then you have more people staying put, less chance for contact. And ultimately what you end up doing is bending the curve or flattening the curve. So that the number of people who are infected, if we go to the next page, the number of people who are infected ultimately at peak is lowest for intensive social distancing, next lowest for moderate distancing. Quarantine is also effective. But obviously, if you do nothing at all, have no restrictions, then you're talking about 90% of people being sick at the peak of the infections. Now, the challenge there is about the health system capacity, like I said. So if you go to the Yeah. So the red line there represents the health
Okay.
system capacity.
Yeah.
So if the health system capacity is high, then you have less of a concern there.
Okay.
But if you're a country like Ghana, where
So now
where you have a
it's
lower,
lowered. Okay.
exactly, a lower health system capacity,
Yeah.
where a lot of healthcare workers, like we heard the Nurses Association recently saying that they would not be in emergency centers if they weren't provided with adequate supplies,
Yeah.
then the risk of having a health system that's prepared for this is quite low.
Okay.
And again, we're trying to reduce these transmissions for the sake of the 20% of people with heart disease, with high blood pressure, with lung disease, with kidney disease, and with diabetes,
Yeah.
who are particularly at risk of developing a serious infection. If we're able to do that, then we reduce the overall burden on the healthcare sector, overall burden on healthcare workers, and allow them to actually respond to the most critical cases in time. Like I said, age is a really major risk factor. So looking at the example of China, you can see that for young people, the risk of mortality is pretty low. Your chance of dying from infection, not that high. It's about the chance of dying from a flu.
Okay.
But as you get older, the risk increases so that by the time that you are 80 plus, about 1 in 5 people who get the infection actually will go on and die. So the idea behind social distancing is to make young and especially asymptomatic people who can pass on the virus stay put, so they're not coming into contact with people who are at high risk and who will need serious care, so we don't overwhelm the healthcare system.
Fantastic. Can we have?
Oh yeah, so this one is just make the case about the question about asymptomatic high risk. The graph, the charts in red are what are testing by Korea. The green is what Italy did. Korea did broad-based testing. You could drive through and get tested. So a lot of young people got tested. Whereas in Italy, they were testing only people who showed up at hospitals with symptoms. But when you look at a country that does broad-based testing, like you see there's a lot more infections among people 2029 who generally don't have serious illness. And because they don't have serious illness, they can walk around, feel good, go to the gym, everything, and still be passing it on. So it's important to be aware of that risk factor as the necessity for areas where young people congregate to be a real focus of the attention of the authorities to make sure that we're not creating hubs for transmission.
Okay, fantastic. So where we find ourselves now in Ghana, the measures have been put in place. Do you consider them enough, or should we ramp it up a notch?
We have to ramp it up. We were a little slow on the trigger, to be frank. Some of the measures that were put in at the airport were not going to be fail-proof if you monitored the process by which people were clearing those areas. We've seen reports about the land borders largely not being adequately manned with respect to preventing or detecting infections. That's happened already. So now the question in the country is, how do we avoid a case of continuous community transmission? That's the absolute priority right now. Professor Bedu Akosa last night was on, I think,
Point of View.
And made exactly that point, that we have to really be serious about mitigating the spread through communities, because our healthcare system is simply not equipped to deal with a drastic escalation of critical cases. Not even if you're talking about Accra, it's not equipped. How much less so other parts of the country where that have been typically ignored when it comes to development. We actually cannot afford to do that. What we should be doing right now, though, is preparing the healthcare system for the eventuality that we do have community transmissions. That means spending some of that $100 million that's been allocated, a lot of it truly, on ensuring that people at the front lines, healthcare workers, are equipped to do their jobs, that we have proper isolation centers spread out through the country, that we have proper triage and acute care centers spread out through the country. But there's also the additional question of how to really buttress the social distancing measures. It's very difficult to explain to a market woman in Makola who lives on her daily wages that stay home because Yaribiaba. That's something that's going to be very difficult to argue. She has to figure out how she's going to take care of her kids, take care of her family. So if our approach is not broad-based, doesn't look at the whole system, doesn't consider how we're going to mitigate loss of income for people lower down the socioeconomic ladder, they will not be able to comply effectively with social distancing measures. And if they can't do that, then we're not going to be effective or successful in this regard. What this really is a test of our national character. We focus on the absolute priorities in terms of healthcare. We recognize right from the top that we are only as secure as the most vulnerable people in our society. And if those people aren't getting the economic support they need to be able to stay at home and not be concerned about loss of income, social distancing will not work. If we're not investing heavily right now in acute care, in triage, in emergency response, we are not going to be ready. And if we're not doing any of those things now, which frankly we should have been doing a month ago, then we have to be realistic here that we're going to have a pretty serious problem.
I'm looking at the transportation system, for example, Trotros, and I'm just thinking about the measures that, have been put in place, and I'm not sure if they're enough, because in a certain sense, we should maybe be halving the number of people that are actually in the Trotros, but then it's a business.
Exactly.
So then, how does a person run his business on half, the numbers?
Exactly. That's what I'm saying, that if we're not thinking about how to provide some kind of, ultimately, if we have sustained community transmissions where we have to go to more drastic social distancing measures, we have to absolutely consider the loss of income factor as a means to disincentivize people going out. So if you know that Trotros are going to have to lose half their income, we have to think dynamically and creatively about ways in which we can actually put in place emergency policy procedures to mitigate that loss of income, so that we can provide a carrot for the people who are affected by it to actually comply. Because the alternative is to use the stick, which is to have draconian enforcement of these policies, a kind of escalation to state of emergency, martial law, that kind of stuff. That will not prove effective because people still have to survive and they'll find a way around it. If we're not mitigating the consequences of people's economic vulnerability in a time such as this, we're not going to be successful in the grand scheme of things.
COVID-19, when do we see the end of it?
If we're thinking about it in the most practical terms, what we're looking for is a vaccine or a cure. Best estimates of either of those two things, especially a vaccine, we're talking about a year to 18 months from now. We have to make sure these vaccines and...
That's a long time.
It's a long time. These vaccines and therapeutic measures have to be tested for efficacy to make sure they work. And we have to make sure they are safe as well, because the worst case scenario is to introduce a
something
worse that has consequences, side effects, whole new ball game. So they have to take the right steps. They can take away regulatory red tape and all those things, but actually making sure it works and that it's safe, that's going to take a year to 18 months. So what we can do right now is about mitigating the spread, flattening out the curve, the infection curve, so that at the peak level, the health system can still manage the cases. So it's right now, the game is social intervention, health system support, so they can deal with acute cases, and then hoping and praying that the cure, the vaccine, comes quicker than that.
Thank you.
My pleasure.
Thank you very much. We've been speaking with Nana Kofi Kwakye, who is an assistant professor at the Department of Health Policy and Management, New York University School of Global Public Health. And he's been helping us to understand and break it down, debunk some of the ideas that people have been spreading out there, and tell us what are the real facts about COVID-19.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.